Thank you, yeah, thank you for the introduction. Last time I gave a talk was a couple of weeks ago at a church, and they introduced me as an abortion rights campaigner. So I'm grateful for a slightly different introduction this time. As Dave said, I work with the Oxford Centre for Christian Apologetics, which is part of Ravi Zacharias International Ministries, so that might be the connection with the hard questions. One of my other backgrounds is working as a medical doctor, so I actually just finished a shift at 8:30 last night. But made it in today, fortunately. This, I think, is probably more important. So I have some kind of familiarity from a medical perspective, from an apologetics kind of perspective, and a communication sort of perspective. But one thing I do want to start by saying is that this lecture talk won't actually be very kind of communication heavy. It won't give you the most sensitive ways to talk about it necessarily. It will equip you with facts. And the reason for that is simply a reason of time. There's lots that can be said about communication and about how to relay some of this information. But just because of constraints of time, I'm really just trying to pack in as much information as possible. Now, the good news is there's a lot of information in here. The bad news is there's way too much information in here. So if I do seem to be whizzing through stuff, don't worry too much. I can send out all the slides. I'd be more than happy to share with you afterwards or answer questions. But don't be too concerned if I'm just kind of skipping over some parts. You can always ask in your own time or after the conference or whenever. So this will mostly cover content. Now, there are kind of 5 particular areas that I want to look at, and these are some of the hard cases and some of the hard questions. There are more than just these hard questions, but these are some of the top ones. And they're supposedly hard cases of abortions, things where abortion seems to be, if ever abortion is right, surely these cases are the cases where abortion is right. How can pro-lifers even be opposed to abortion in these cases? And so the first, I've tried to put them broadly in order of kind of the difficulty, starting with the most simple first, which is the case of unwanted children. What if a woman really doesn't want a child? Won't it be better for the child if they don't have to go through a painful life? Secondly, life-limiting diagnoses, also known as fatal fetal anomalies, or sometimes called fatal fetal abnormalities in more old times. In the abortion law itself, they talk about serious handicaps, so you can see how the language changes quite a lot. But I'll be talking about babies who are not expected to live very long at all. Life-saving abortions. Isn't abortion sometimes okay to save the life of the mother? What about the question of rape or sexual assault? Surely a woman has not even consented to being pregnant in any sense. She hasn't done anything that would, make her expect to be pregnant. It's not her fault. How can you still say that she's forced to continue a pregnancy? And finally, the case of Backstreet abortions. Isn't it the case that if we ban abortion, women will just die from illegal abortions without actually changing anything else? All it will do is kill women. So these are some of the challenges. But I do want to begin by firstly saying, kind of leveling the playing field a bit, by saying that if we do have to talk about the hard cases as pro-lifers, it's only fair, I think, that we also are aware of and draw attention in our conversations to the hard cases for pro-choicers. So what about things like partial birth abortion, where the baby is halfway delivered and then killed, as is still, we think, legal in the UK. It doesn't happen much, or we don't know if it happens at all, but it probably is legal in the UK. Late-term abortions, there are thousands of these in the UK each year. Dilation and evacuation abortions are the minority of abortions, which are colloquially called dismemberment abortions. These are a minority of abortions, but they're still common. There are still 9,000 or so in the UK every year. Sex-selective abortions. These are responsible for about 100 million missing women, according to the UN, in the world today. The UN doesn't say that this is because of abortion. It says this is due to son preference and sex selection. The reality is, in most cases, this is abortion, and that there are 100 million missing women from the world today because of it. Abortion for disability, we'll see more about that in a while. Colonialist abortion, what I mean by this is that in many parts of the world, pretty much everyone is pro-life. So if you look at surveys, recent polling from much of the global south, particularly sub-Saharan Africa or the Islamic world, the Pacific Islands, pretty much everyone thinks that abortion is wrong and they don't want it in their country. So in Ghana, for example, they asked, is abortion acceptable or unacceptable? 98% said it was unacceptable. That is the kind of culture in many parts of the world. And yet the British government and many other governments pour millions and millions of pounds into funding changing the laws in countries that really don't want their laws to be changed, that really appreciate the value of unborn life. Forced and coerced abortions, we've seen recently in the UK, I don't know how many of you saw this, that the state basically ordered a woman to have an abortion after the doctors recommended it, and it was only stopped at the last minute by a last minute legal challenge, but the initial court said that she should have it against her will. We know many other cases where people are pressured by other sources, doctors or spouses or family or abusers in some cases. These are difficult cases. There are babies left to die after abortions, which is why they now, in the guidelines, recommend that a baby has to be deliberately killed, called feticide, before the baby is evacuated from the womb in late-term pregnancies. And of course, plenty of scandals with abortion providers like BPAS and Marie Stopes International and so on. So there's a whole litany of hard cases either side. And really, I think what I want to say is pretty much the only communication tip I'll give is set the rules of the discussion first. So either agree with the person you're speaking to if they disagree. Agree from the outset that you're only going to talk about the 99% of abortions, the kind of average case, the one that doesn't involve kind of sexual assault, the one that doesn't involve a life-limiting condition, and so on, and just say, let's talk about the overwhelming majority, the thousands and thousands and thousands of abortions that happen, setting aside the more difficult cases. Or if you do want to talk about the hard cases, or if the person you're discussing with does want to talk about the hard cases, at least level the playing field a bit by saying, okay, we realize that there are actually hard cases for both sides, so we should speak about both of these. So let's get into those hard cases. The first one, which I said is in some sense the most simple, even though it's a hard case, is the case of unwanted children. Well, the most basic response here is to say that who says they have bad lives? So the classic scenario where someone says, well, this person is unwanted. How can you justify bringing an unwanted child into the world? They'll have such a horrible life. And they really will be they would prefer that they never had existed. Well, realistically, there's simply no evidence to support the idea that children born into difficult circumstances, on the whole, resent their lives or regret being born. On the contrary, most children seem to be very glad that they're alive, even when they were born into very difficult circumstances. And that is why, of course, we don't make the same argument for unwanted born children. We don't say if someone has already been born into poverty and into a difficult family situation, it's better for them not to have lived at all and so end up taking their lives. We would never use that sort of reasoning for a born child, and so human equality suggests that we should not use it for a preborn child. But actually there's this other argument that kind of comes up, which kind of accuses pro-lifers of being hypocrites, saying, well, who is going to look after these children then if the mother can't? I don't see Christians or pro-lifers stepping up to look after all these unwanted children. Where are they? They just care about making the baby be born and then completely neglecting it. Again, there's really very little evidence for any of this. The most interesting evidence, I think, is if you look at adoption kind of studies and adoption statements and the information on it. It's actually pretty much impossible or very, very difficult to adopt a newborn baby in the UK because there are so few of them. So there is a long list of people waiting to adopt a newborn baby in the UK, and they're simply not able. So it's not the case that there are many newborns being born who have no one to look after them. In The Independent, they reported it this way. They said, demand for babies is so high that this adoption agency doesn't list its name in the yellow pages. Their fear is being swamped with calls. We just can't handle it. There aren't any more babies available, says a spokeswoman. And in The Spectator a few years ago as well, it talks a little bit about the waiting times to adopt other sorts of children in different circumstances. And it says up to 9 years, typically, to wait to adopt a newborn. So it simply isn't the case that there are all these newborns waiting to be adopted, and that Christians and pro-lifers are not stepping up to do this. Nor is it true that the pro-life movement doesn't support women in difficult situations, pre-birth or after birth. In fact, the opposite is true, that there's an immense amount of support offered by pro-lifers, much of which you'll have already seen today. We have better data from the US, but in the US in 2017, for example, pro-life pregnancy centers, of which there are nearly 3,000 of them, served almost 2 million people in a year, saving about $160 million at least. There were 400,000 free hours offered by sonographers. There were nearly 70,000 volunteers, including nearly 8,000 medical professionals. And all of this is pretty much done voluntarily through funding, through kind of giving of people's own time, people's own expertise. Whereas if by contrast you look at abortion providers themselves and the support that they give to women, ostensibly enabling those women to make a choice, Well, if you look at those abortion providers, they get millions and millions of pounds and dollars in funding from governments, from extremely rich billionaires around the world. So, for example, Marie Stopes International got £70 million from governments in the UN in 2018. If you ask them what do they do for women who want to keep the baby and how do they support women who have already had a baby, there's very little answer. And if you compare, therefore, the funding between the pro-life and the abortion providers, and if you compare what they actually do for women after birth, I think it's clear which one really supports women both before and after birth. So then moving on to some of the more difficult categories. This is a kind of overview of that kind of 99%, an overview of statistics about when abortions happen, in which circumstances abortions happen, and why. So in the UK, there are about 200,000 abortions a year. This equates to about 1 in 3 women in their lifetime in the UK. 98% of these, before 24 weeks, are for physical or mental health reasons. And actually, if you look at the statistics, it says that of those, about 99.8% are for mental health reasons. So really, 98% of abortions in the UK are officially done for mental health reasons. And this is always specified as mental disorder, not otherwise specified. So it's not a recognized mental health concern. It's simply someone has said their mental health will be affected, and it's been licensed, therefore. And this can include sex-selective abortion in the UK. The remaining 2%, most of those, about 3,000 to 4,000, are for what the 67 Act calls serious handicap, which we would now call disability or differently abled people or certain medical conditions. 3,000 of these are after 20 weeks of abortions in total, and at most there are about 100 to save the life of women. And that's really an upper estimate, and possibly quite a number of these aren't actually strictly necessary to save the life of the woman. So let's go with the kind of cases first in terms of disability. Abortion, as I said, for disability is legal up to birth, possibly even during birth. There was a bid to outlaw it, I think, back in the 90s in the UK, and it didn't go through. And no one denied that it was legal. So as far as we understand, this is legal to abort for disability during birth. There are over 3,000 in the UK and rapidly increasing each year. This ends up essentially having the consequence that 80 to 90% of children diagnosed with Down syndrome in the womb will be aborted, and that equates to about 700 to 800 in the UK every year. And actually many other conditions are grounds for abortion up to birth, including things which are surgically correctable, like cleft palate, including twins, for example. You can choose to have one of the twins to have their life ended, and so on. And the disability doesn't actually need to be proven. So there are probably also some children with no disability or no condition at all who are aborted under these grounds up to birth, as I said. This kind of discrimination in the law, which allows abortion up to birth for children with disabilities, but only up to 24 weeks for other children, has been condemned pretty widely by everyone, including some very pro-abortion authorities. So the Disability Rights Commission, I think, was set up in the Blair government, correct me if I'm wrong, and it's talking about this section of the Abortion Act. This section is offensive to many people. It reinforces negative stereotypes of disability, and there is substantial support for the view that to permit terminations at any point during a pregnancy on the ground of risk of disability, while time limits apply to other grounds set out in the Abortion Act, is incompatible with valuing disability and non-disability equally. Likewise, the UN, which is an extremely pro-abortion organization that tries to push it on the rest of the world which doesn't want abortion, says that, at least in one of their committees, one of their subgroups, on the rights of people with disabilities, they say the committee is concerned about perceptions in society that stigmatize persons with disabilities as living a life of less value, and about the termination of pregnancy at any stage on the basis of fetal impairment. The committee recommends that the state party, I think it's talking about Spain in this case, I'm not sure, amends its abortion law accordingly, and so on. It says that this law is ultimately discriminatory. And this helps to bear in mind when we're talking about thinking about abortion in that hard case of disability, or particularly life-limiting disability, that actually it's pretty widely agreed, even by very pro-choice authorities, that this sort of distinction in the law is actually very clearly discriminatory and is incompatible with human equality. And so I've just included some statistics here about the numbers of children who are aborted for different reasons, different medical conditions found. Some of these are very severe, complex conditions. Anencephaly, where a child is born without most of their brain or with their brain extraordinarily changed in a way that usually doesn't allow them to live for a very long time, is an extremely difficult condition to manage, and it does have a very bad prognosis. Most of these children do not live very long at all. On the other hand, there are many children aborted, as I say, for cleft lip and cleft palate. You can see in the government statistics, they've said about 9 children were aborted for those reasons in 2017. Other reasons, Down syndrome, about 700. You can see multiple gestation at one point, which is essentially twinning, and other reasons. So there's a huge variety of reasons given for abortion for disability. And these are just statistics which I can send around on the method of abortion for those abortions. Now, of course, there's a harder question about life-limiting diagnoses. So we can all agree, I think, that people who have a genetic condition, perhaps, but who have a reasonably ordinary lifespan to be expected, most of us would say, actually, we think those people are really valuable and they should be allowed to live. Or at least everyone in this room, I imagine, would say that. Many people find it much more difficult to explain and understand these ideas when we're talking about babies who really do not have a long time to live at all, who are either expected to pass away in the womb or shortly after exiting the womb. But one of the first things I think we should say here is that often kind of suggestions that abortion should be allowed in these circumstances are based on profound prejudice about the value and the quality of life of disabled people. So there's actually been studies on this, perhaps stating the obvious, but Scott Coe and a number of his fellow researchers show that 99% of people with Down syndrome are happy with their lives and are glad that they were born. Now, as I say, to most people here, probably to everyone here, this is blindingly obvious. But actually, the way that abortion is talked about leads people to think that people with disabilities really do not enjoy their lives and would rather not have been born at all. Perhaps more surprisingly, there's a condition called locked-in syndrome, with which some of you may be familiar, in which, usually due to a stroke, there are people who are unable to move really at all except to move their eyes and blink. This is a profoundly disabling condition, and it's one that when I have imagined or tried to imagine having it, I cannot even imagine tolerating a life like that. It's extraordinarily difficult to understand living in that condition and to understand living in that condition and actually being glad that you're alive. I certainly find it difficult to sympathize with that. And yet when we actually ask people with that condition, there was a study which showed that they rated their quality of life on average as about a 7, which is the same as an average student. So really, we make deep and huge assumptions about the quality of life that people with disabilities have, and of course about the value of life that people with disabilities have. And the value of that life is obviously always infinite. What actually is also interesting is if we look at the mental health evidence when we look at the mothers in these circumstances. So often these kind of cases are framed in the media as extraordinarily distressing cases, and of course they are. Any woman who has had a diagnosis of their child in this way, where they're told that their child is unlikely to survive for very long at all, any woman going through that is going to find it extraordinarily difficult, and rightly so. It's an extremely difficult situation to go through. But what we're usually told in the media is that the obvious thing to do in that case is essentially to cut things short, to make her to not force her to go through extra torment, and simply to end the pregnancy in a way that kind of doesn't prolong that suffering that she is experiencing. But again, if we look at the evidence on this, which is never told to women in this harrowing situation, the evidence points to quite a different story. Yes, in all of these cases, it is tragic and it's extraordinarily difficult for the parents. But out of those two extraordinarily difficult alternatives of ending the pregnancy or continuing the pregnancy, it seems that women who continue the pregnancy seem to have much better psychological outcomes. So a study from a couple of years ago, I think just last year, by Wool et al. Found that 97.5% of parents in this situation who continued the pregnancy had no regrets whatsoever. And Wool describes those feelings that they describe about the opportunity to love, hold, and meet their child, even for a very short time. And there are other studies which show similar things, and that this is true for parents whether they're religious or not. Other studies have shown the importance in cases like this of parents spending time with their child, either alive for a short time or even with their child who has passed away. They've shown the importance of parents spending time with that child for getting long-term psychological outcomes. In terms of other mental health considerations, these are typically wanted pregnancies in the first place, and it was a reluctant, painful decision to end them, which is a risk factor for having psychologically poor outcomes after a termination. In 2017, a paper in the kind of top midwifery journal, Midwifery, described women's experiences of delivery after abortion in these cases, and described these experiences as overwhelmingly negative. And they also documented the importance of spending time with the baby afterwards. And they quote a number of women who say things like, "No one can understand the torture of having an abortion in that case. It was one of the worst things in my life. There was no hope. I thought I would die." Likewise, NICE, just this year, I think, in fact, published an evidence review of abortion in these cases and the impact on the mother. And they said very similar things, that it's almost an entirely overwhelmingly negative response to abortion that women have. Most of the women were not able to work or do anything. I had a hard time to focus the first 3 months after termination. Everything felt quite meaningless. Most women find grief intensifying for the first 3 to 6 weeks and lasting until the due date, and so on. And there's lots of talk of torture and of it being the worst experience that anyone could possibly go through. Now, if we look by contrast at women who have the baby in those conditions, yes, it's obviously an immensely difficult thing to go through for the woman and for the man, and for anyone else in the family. But if we compare the two options, both of which are extremely bad options that no one would want to go through, it seems that the better psychological outcomes are there for people who continue the pregnancy and have some time to spend with their child and who really cherish that time. And there's actually a direct study by Cope et al. Showing that a direct comparison between these two groups of people shows that those who continue the pregnancy have better psychological outcomes. So then to move on to life-saving abortions, as I say, these are very rare in the UK. So in emergency situations, there's only about one abortion a year to save the life of a woman in emergency circumstances. If you include non-emergency circumstances, it goes up a fair bit, but still to about at most 100. In most of these cases, the baby will die if the mother dies, and so the options really are to save one person or not to save anyone at all. And for that reason, most pro-lifers say that abortion is permitted in these circumstances because you are saving one life as opposed to not saving either life. But when you have an abortion in those circumstances, there is no intent to end the life of the child. Rather, the ending of the life of the child is an inevitable consequence, and it's a foreseen consequence, but it's not an intended consequence. And so many people would say that this strictly does not count as an abortion, thinking that abortion is only intentional ending of life. And of course, most countries in the world allow abortions in these circumstances. Certainly Ireland did, despite the hype around the Ireland's law. Northern Ireland, until the recent change, also allowed abortion in these circumstances. And again, some data that we got from the Department of Health just on which kind of life-threatening conditions were involved in these cases. You'll see that some of them are for mental health, only 5 in 2017. It's unclear exactly how serious this threat to someone's mental health was, but you can see that there is some room for kind of malleable interpretation of the life-saving abortion clause. Kind of penultimately, we'll come to probably I think this is the most difficult question to speak about, particularly as a man. The question of sexual assault and what about abortion in the case of rape. And again, I should say that I'm going to whiz through this way too quickly, and that the whole point of communicating on these hard cases is that we do have patience and that we do have time to speak about them with people in a pastoral context. So please don't take this as a model for your pastoral engagement on this. Firstly, I think we do need to say something just about the incidence. How common are these? Different studies suggest different things, but I've never seen a study showing more than about 2% of abortions being for the case of rape. In a 2005 study, they suggested 1%, but even in that study, they said that sexual assault or rape was the main reason for the abortion in less than 0.5% of the cases. They didn't say exactly what percent of cases, but it was essentially 4 or fewer women out of nearly 1,000 women. So extraordinarily rare that this is the main reason for having an abortion. The more recent data from Florida last year suggested it's much less than that, 0.1 to 0.2% of abortions. So an extremely rare case. But I would always counsel whenever I speak about this, initially starting by saying that these are an extraordinarily rare kind of minority of cases, but not leaving it at that. I would always say these cases still matter because these women matter and these children matter. So certainly I would not recommend in any way using the rarity of them to kind of undermine the importance of them, because that can make people feel unrecognized, essentially. But a way to approach this that I usually start with is ultimately the fundamental question, will abortion help heal a woman who has been through sexual trauma? Now, there are only 2 options here, and neither of those options eliminates the trauma, neither of them gets rid of the trauma, neither of them wipes away the suffering in an easy way or a simplistic way. There is no easy or simple way to deal with this kind of trauma. But of those 2 options, one of them really at best patches over the trauma and pretends it never happens, and often fails in that pretension. Whereas the other, I'll give some evidence to show, can lead to deep healing and victory in surprising ways. And there are 2 ways to answer this question ultimately of whether abortion will help heal. Those are by listening to women and by looking at the evidence of what women say on a larger scale. So when we listen to women, what do they say about these situations? Firstly, they say it's deeply personal, and actually that we need to listen to women rather than just making assumptions on their behalf. We need to give these women a voice, and yet these women are usually silenced. So in the Ireland campaign against abortion, some survivors of rape were invited to give a talk, a pro-life talk, all over Ireland, and many people just cancelled their talks and refused to host them even after initially agreeing because they were pro-life. And so these women's voices are actually often silenced, which is one of the worst things that I think we can do. It goes without saying that many victims of sexual assault don't want to be exploited for the pro-choice cause, and certainly not for abortion on demand. Women actually say that possibly even the majority of times they keep the baby in these cases. We would never expect this because most medical counsel in these cases, most family counsel and counsel from friends is to obviously have an abortion in these cases. But actually repeated studies seem to show that most women continue the pregnancy in such cases, even despite this pressure to abort. And actually studies seem to suggest that abortion is often regretted in these cases, whereas having the baby in these cases is almost never regretted. So there's a book by David Reardon called Victims and Victors, which is essentially a group of testimonies of 200 women who were the victims of rape and who became pregnant, some of whom had abortion, some of whom gave their child up for adoption, some of whom raised the child themselves. Not a single one who continued the pregnancy regretted doing so. But actually, I think most women who had abortions in those circumstances regretted it. And this is something that we don't hear. But that book does a great job of actually listening to those women. One of these women is Helene Evans, who says exactly this: abortion does not help or solve a problem. It only compounds and adds trauma to the already grieving victim. It only takes away the one thing, her child, that can bring joy. So let's think a little bit about the psychology of these cases. What actually goes on when we're thinking about psychology? Well, one of the most important things for trauma victims in general is for them to make sense and derive meaning from their traumatic experience, so that they have some story in which to place their experience to make some sense of why it happened. Now, abortion, it seems, can never do this. Abortion can never make sense of what is going on. It can never provide meaning for a woman who has lost her sense of hope and meaning because of the trauma that she's been through. But actually what these women who have been through this have said themselves, so don't take it from me, take it from these women, is that having a child can be a profoundly healing and victorious way to find meaning in that deeply painful experience. We know this is extremely important for people's psychological well-being. There's a psychologist who I don't think is religious at all, never seen him write about the pro-life debate. He says actually the main results of a study he looked at was that for both adults and students, the more redemptive the life story, the more kind of pain that was overcome in someone's life through healing and through victory, the better a person's overall psychological well-being. And they had better psychological well-being than people who had never really experienced much pain. And of course, as Christians, we know this in the most profound way of all, because we know that victory through suffering actually came in the deepest way, and that it is profound because that is exactly what Jesus accomplished with us and for us. I'm going to skip a bit here just because we're short on time. One final thing I'll say about this is that the mental health evidence in general, there's not very good mental health evidence in the case of sexual assault, but the mental health evidence for abortion in general shows pretty unanimously that there's no evidence that abortion helps a woman's mental health. But actually there's significant evidence that abortion is bad for women's mental health. So there's the most recent major review conducted by a pro-choice psychologist, David Ferguson, in 2013 in a top psychiatry journal, showed that even when you controlled for all the other factors like prior mental health or whether the pregnancy was wanted or socioeconomic status, even when you kept all of these constant, women who had abortions had more anxiety, more drug abuse, more alcohol abuse, and more suicidal thoughts and behaviors than women who continued the pregnancy in those circumstances. And this is borne out by other studies which show higher suicide rates, much higher suicide rates after abortion than after continuing pregnancy, and much higher mortality rates. And so actually, to kind of sum all of that up, really when people invoke the case of sexual assault to talk about abortion, they're often making huge assumptions on behalf of these women and saying things that these women, if you ask them yourself, do not say. And I'll leave these for you to read through if you want the slides afterwards. But this is usually based more on prejudice than on actually listening to women. And so, again, to sum up at the case of sexual assault, the question is not, will the victim suffer? Because we know that whatever happens, a victim of such a horrendous crime will suffer. And it's not a question of who will make them suffer. The question is ultimately, will abortion help them heal? And what is the unborn? Those are the two ultimate questions. And as I've suggested, there are two options there, both of which involve an enormous amount of hurt and sacrifice and difficulty, but one of which seems to try and wipe away the crime and add to the trauma, and one of which can be a very profound way of healing. And so you could sum up by saying that abortion only adds a second trauma to the victim and a second victim to the crime. Finally, we haven't got long left, but just for a few minutes, I want to talk about the case of Backstreet abortions, and I'll try and do this in a pretty systematic way. I've got 4 main points here. So firstly, when it comes to Backstreet abortions, the question of the morality of the abortion is still central. Some people try and use Backstreet abortion as a way of saying, it doesn't matter what you think about the morality of abortion. I actually might think abortion is wrong. I'm pro-life and I oppose abortion. But I think that all banning it will do is lead to dangerous Backstreet abortions, which don't stop abortions, but which lead to women dying. And so they try to say that actually the morality of abortion is irrelevant. Well, actually, my first point is that the morality of abortion, the ethics of it, is absolutely central. Firstly, because the law plays a powerful, expressive role. It expresses what we believe about humans and about human dignity, even if no one obeys it. A good example is the transatlantic slave trade. Many people initially who were opposed to abolition of the slave trade said that it doesn't matter really whether slavery or the slave trade is wrong, it will still happen. And so we need to make sure it happens in the most safe way possible. That's completely wrong. We know that whether people do it illegally or not, we need to say in the law that people who were being trafficked in the slave trade are equal human beings worthy of dignity and respect. And that goes no matter what the consequences of that law will be. But actually we can see this. There's already been a couple of mentions of Wilberforce today. I won't read through all of this, but he says essentially the same thing, and he's responding to essentially the Backstreet slave trade argument. And what people said at that time was that abolishing the slave trade led to revolutions in the Caribbean. It led to revolutions that killed many people. In one case, they say the slave trade went on illegally, so 60,000 slaves were being shipped across the Atlantic each year, many of them illegally shipped, even once abolition had been put into law. Illegal traders often used ships which had not been designed for holding slaves at all, cramming them into the holds of converted warships and other vessels, which gave the victims even less space than in the days when the British trade was legal and regulated. We can see the parallel very clearly here. In both cases, yes, there will be some illegal activity that goes on even if it is made illegal. And perhaps you could make the argument that a legal regulated system is ultimately better. But I think in hindsight, we know that that perspective does not work. And actually, banning the slave trade did lead to its abolition eventually, at least in that form at the time. and led to much better prospects for everyone involved. The other reason the morality is central and why you can't use this Backstreet abortion argument this Backstreet abortion argument is that we know that pro-life laws do work, and there's a whole list of studies that I'll give a reference to, but we know that when you put in pro-life laws, whether banning abortion or putting limits on it or putting financial restrictions on it or putting kind of informed consent laws in, all of these reduce the numbers of abortions. And just as a kind of example of that, the BMJ just 2 years ago, the British Medical Journal, estimated that just before the 1967 Act, there were 10,000 abortions in the UK every year. And of course, with much more widespread contraception and legal abortion, that figure has multiplied by 20 over the last 50 years. And this is a reference to a bunch more studies showing that these laws work. Secondly, what about the question of mortality from illegal abortions? What about women who will die as a result of illegal abortions? Well, essentially, one of the short answers to this is that most of these figures were completely invented by admission of pro-choicers. There were very few deaths from illegal abortions in the developed world even 50 years ago, and now there would be almost none, or probably even none. Bernard Nathanson was one of the foremost pro-choice doctors in the movement in America in the 1970s, and he says, how many deaths were we talking about when abortion was illegal? In our organization, we usually emphasize the drama, but we spoke of 5,000 to 10,000 a year. I confessed that I knew the figures were totally false, but in the morality of our revolution, it was a useful figure, widely accepted, so why go out of our way to correct it with honest statistics? Likewise, Mary Calderon, who was the medical director of Planned Parenthood, which is the main abortion provider in the US, said when abortion was still illegal in the US, abortion illegally is no longer a dangerous procedure. It's carried out in sanitary conditions, and there are not many deaths from it at all. Abortion, at the end, you see, whether therapeutic or illegal, is in the main no longer dangerous because it's being done well by physicians. Just to give some statistics on that, in 1973, when abortion was legalized in the UK, there were only 19 deaths recorded from illegal abortion. And 50 years later, we would expect that there would be far fewer, and I would hope none at all. By contrast, if you look at mortality from legal abortions, I think we can expect significantly more. Even now with legal abortion, some women in the UK die directly from legal abortions from complications such as bleeding. But actually, abortion also seems, according to the studies, to contribute to one of the biggest killers of women of childbearing age, which is suicide. I already gave some evidence on this, and I'm not going to go through it in detail. But studies suggest that potentially between 1% and 5% of all suicides among women can be attributed to abortion. And actually, if you look at the statistics and work out how many women would be affected, therefore, you could actually make the argument that at least 15 women die from suicide as a result of abortion in the UK every year. And that alone probably exceeds the likely mortality rate from illegal abortion if abortion were to be made illegal. And so finally, in responding to this, and as I say, I've gone through this way too quickly, we have to think about the human cost. No option is without cost in human lives. Someone who asks the question about Backstreet abortions is trying to kind of come up with a utopia where they say, look, these women are dying if abortion is made illegal. How can you allow that to happen? Now, of course, these are tragic cases and we don't want that to happen. But the point is that neither option is completely without cost in human lives. So yes, it's true that some women may die in illegal abortions in the UK if it were to be made illegal. I think the number would be very few, probably less than 5. It would be very few in any case. That is obviously a tragedy, but we have to weigh that against the other tragedy of legal abortion. And the human cost of legal abortion is exponentially higher. Plausibly, you would have even more women dying because of the suicide rates associated with abortion. You would have a culture and a law that says at its root, not all humans are equal. And of course, the ultimate thing which all of this comes down to, whichever hard case you're talking about, the human cost from allowing abortion, even if you consider the hard cases, the human cost is at least 200,000 dead unborn children in the UK every year. That is something that I don't think can be outweighed very easily, if at all. And that is something that the pro-choicer has to reckon with when they're thinking about these hard cases. So, as I said, this was an extremely whizzed through, way too speedy talk. I'm sorry if I've gone slightly over, I think I probably have, but thank you so much for your patience, and I look forward to questions.